nothing easy about having a child with diabetes. I don't personally have a child with diabetes. I can't imagine the frustration that goes along with the daily regimen of making sure that your child survives, because that's really what it's about. And then the feelings that accompany that of feeling isolated or sometimes lonely in different environments because of this new reality that you live with. And that's what I really want to delve into here. And the most important thing that I'll emphasize right here from the beginning is that you're not alone. And the purpose of this webinar is to make sure that you feel that you're not alone and that you hear your story through the course of the sharing of our stories and the questions online. Before we get started, I want to introduce you to this panel of experts that has so graciously given up their time and their energy and their talents to join us tonight. So we're going to start right here. Our parents, you represent the dads. This is Sam Jarzinski. You have a son who has diabetes who is 13 years old.
Right.
So right in the middle of the teenage time period and transition. The next one that we have here is Ursilia Cologne. Ursilia has two children who live with diabetes, one that's 19 and one that's now 25, both boys.
Yes.
And diabetes is relatively new to Ursilia. It's only been the last 3 years, right?
Right.
Okay, our next panelist is Dr. Kathy Bradley Klug. She's a psychologist who specializes in pediatric school psychology right here at the University of South Florida College of Education. And we're so happy that you've joined us. And then last but certainly not least, he's a celebrity in diabetes, Joe Solowaychek. And Joe is a nurse, you're a certified diabetes educator, and a family therapist.
Yes.
And known all over the country about keeping it real with diabetes and helping families cope better. So thank you everybody for joining us. So Joe, why is it that so many families struggle with this notion of frustration in living with diabetes?
It's a great question. It's a great place to start with. I can also not speak for, I don't have a child with diabetes, but I have lived with it for 52 years and have been working in the field for about 32. And I can tell you that the thing that comes up most for most of the families that I work with, and for myself included as a patient, is that I don't think it takes rocket science to manage diabetes. I think at the beginning you're scared and you're afraid that you're not going to get it. And the first question you're asking the hospital is, when can we leave? And then when they want to discharge you, they say, can we live here? Because they're so scared about going home and doing it by themselves. But I think at the end of the day, after you've sort of learned the things that you need to learn, it has a lot to do with it's like another full-time job. And I think that contributes to the frustration. It's ongoing, it's no stop, there are no breaks. If you're the parent of a child, you have to assume some of the sort of kids' feelings and sort of thoughts about what they're going through, how they're going through it. You have to keep balancing things. There's not one part of your lives that is not touched by diabetes. Now, at the end of the day, the goal is to make sure that everybody unfolds into their lives and has a life and is doing what they do. It shouldn't stop you from doing anything, but you have to bring a lot of courage and determination as you're going through it. And the feeling when you're hit with this at first is that if you've never had a child diagnosed with a chronic illness and you know nothing about this disease, you're at a loss as to how you're going to make it. And that's why support communities are so, so important.
Now, a lot of people tend to fall into a trap after they've had a child diagnosed and maybe have been living with disease for a little while, where they isolate themselves because that's how they can control their environment. Is there danger in that?
There's total danger in that, because what ends up happening is that you're all alone. And I think if you want, you can do it all by yourself, but it's extremely lonely. And it's extremely lonely for your kids, and it's extremely lonely for your family. The goal in learning how to manage diabetes is so that your life after diagnosis looks as close to what it was prior to diagnosis. If you were lonely before diagnosis, then you should stay lonely. But if you were actively engaged and with people and doing stuff, and your kids were, and you were traveling and all that kind of stuff, then you should get back into doing that. Now, should get back into do it, you should do it as soon as you can. Everybody's on their own time schedule, and they have a lot of things that they have to everybody's balancing and juggling different things. But the bottom line is that over the course of time, your life should unfold as it would have had you not had the diabetes, while taking into consideration that things have changed. It's a firewall, which tends towards isolation sometimes, because you frustrated, angry, resentful, rageful at life for handing you this card, you know, this kind of stuff. So
And that's normal.
and that's totally normal. You're nuts if you don't have those
Yeah.
things. So, yeah.
You know, Kathy, I know that you've got expertise in a whole realm of healthcare conditions for pediatrics and children who live with illnesses and families. How do you, or how have you advised families that are dealing with these kinds of issues of where do I put all of this frustration and anger, and then how do I deal with communities or social settings where I'm feeling isolated? Maybe I'm not causing that, but I feel this way.
Right. And I also want to say that I am not a parent of a child with diabetes, but as Nicole said, I do work with families and children who are coping with a variety of types of chronic illnesses. And I think, first of all, it's important to acknowledge the feelings of the parents. And it's okay to feel lonely. It's okay to feel frustrated. It's okay to feel isolated. And that is part of the normal progression. What I like to do with families, with parents, is to help problem solve. And one of the ways to do that is to look at what resources are available for the family. So to help them with that feeling of isolation and frustration. And we kind of go through what are the resources that you have available now, and what resources would you like to have available, and how can we strengthen those? So within those resources, we look at child resources. And one of the issues is, how much does your child understand about the chronic condition? And sometimes that's referred to in the literature as health literacy. But how much can the child take on in terms of responsibility for managing the disease so that you don't feel quite so isolated? We look at family resources and how the condition impacts the family and the siblings in the family, and what resources can we put in place there to support the family. We also look at community resources that are available, mental health resources for family, as well as medical resources, and what's available in the geographic area for the family. We also look at school resources, and as a parent of two boys in schools, you know, when you take your child to school at 8 in the morning and they're there until 3:15 or 4 o'clock in the afternoon, you're leaving your child with people that, you know, you hope you can trust and hope you will help you with that feeling of frustration and isolation. So developing those connections with school folks so that you don't feel like you have to do it all on your own, and so that you have individuals that can take on some of the responsibility.
And school psychologists are a good example of people that are willing to help, right?
Absolutely. I think, first of all, we think of school nurses when we think of chronic health conditions, but school psychologists, pediatric school psychologists, those are also folks within the education